Hey, this is Mike McManaman, class of 2005, down in Hattiesburg, Mississippi, on the campus of USM. Thought I'd provide you a little bit of an update on COVID-19 down here in the Deep South. Currently here with my dogs. We're on a little car ride. They still want to get out of the house, but we got to maintain our social distancing. So we're doing it by staying in the car and going for a little car ride. So my day-to-day is not a whole lot different. I already work from home. A lot of people now have to work from home. They're not used to it, but I've always done that. I haven't been able to travel for clients. It's something I typically do is in my job is go from site to site, but there's big companies are not having anybody do any business travel. So besides that, my fiance is a medical student. She has been sent home. They're not allowing any of the medical students to go to hospitals. They want to lower the risk of spread. I'm sure there's some kind of idea behind not having them come and use up masks and stuff like that. My view from in general from the public down here is a lot of people are taking it seriously. They're closing more and more things every day. A couple days ago you would see people actually still dining in. That's totally gone away. Local politicians have closed down the facilities around here, the restaurants and the library and stuff like that. So it's really quiet. I'm on a quiet campus right now. They've closed the schools. I'm trying to get takeout more. I think that's important for me right now. I'm actually eating out a lot more because I'm trying to support a lot of local businesses. I've noticed a lot of them have started to, I don't know if they're going to go out of business completely, but a lot of the workers are laid off and they're not doing anything right now. So my two big points, everybody knows to wash your hands and keep social distance, but there's two big things to consider. One is this takes a financial toll on a lot of people. So I'm trying to do things like eat out more. I've made some donations to different charities and stuff like that because I know a lot of people are unemployed right now. So we have to support people financially. And there's a lot of mental health issues right now for people. They're struggling a lot. There's money problems. There's isolation issues. So if you can, do the social distancing, wash your hands. Also call your grandma, call your grandpa, call the people that maybe don't always get to go out and do things right now. And call the people are suffering through depression or whatever issue they may be having, because this is a tough time to be isolated. So I'm going to say it one more time. I haven't said it in a while. This is Mike McManaman reporting from Hattiesburg, DTV News.
Hey guys, Paul Goerke here. As you may or may not know, I am a brand new New York City resident. I must say, this was not the city as it was described to me. I'm coming at you from the so-called center of the universe, Times Square. Millions of people are here every single year. Generally, where I'm standing is packed with panhandlers, performers, shoppers, tourists. But as you can see, it's just us, which is quite unnerving in the biggest city in the United States. Public transit is very similar. Nobody's on the subways, nobody's taking the buses, and the sidewalks are also fairly devoid of people. That's ABC's headquarters, by the way. That's a different network, not the one I work for. Stay here. Anyway, my first 3 days walking to work was like jumping into a stream on the sidewalks, just joining the flow of traffic, bumping and bustling around. And it's not like that now. Sidewalks are empty. And you're lucky to come across another human being or two on your way into the office, if you're in the office at all. I've been working at home this week. In fact, NBC News has 90% of its workforce working remotely now, which, by the admission of our own big bosses, was something unimaginable until the last few days. I hope you guys are staying safe wherever you are. I'm trying out here. New York has the most coronavirus cases in the country at the time of this recording. That said, it seems like people are taking social distancing and flattening the curve seriously, which is why I'm out here by myself. Take care, everybody. See you around.
Hey there guys, it's Matthew Smith, former DTVer. We're here in Seattle right now, actually getting ready to be done with work for the day, heading out, but I want to show you guys, if you look over my shoulder, we don't usually see it like this. Pretty empty newsroom. This is actually part of something that we're doing, trying to keep up with those protocols of social distance. We have a stay-at-home order that's come in. We're technically considered essential staff, but we're still doing our part to try to cut down on how many people are in and out of the building. So I'm actually walking out for the day, and I'll kind of walk you through what we're seeing. Hopefully we'll get outside and get an idea just how quiet things are here. But basically, we were the first state in the United States to have a coronavirus case, the COVID-19 disease. And as a result, we've been kind of dealing with this for a long time, and I think we're seeing a lot of the things that other people are getting used to. Now, ironically, we were not one of the first states to order a stay-at-home order from the governor. That came down much later. In fact, just the week that I'm speaking with you right now. So one of the things that we noticed right away was people didn't really think that this was such a big deal because there was no real mass response to it. But as we started having deaths pop up on our radar, and as we started reporting them, people started asking more questions. They got more concerned. And really, I think we're just kind of dealing with this in waves. At first, it was just the public health crisis concerns. Who could get sick? How does this work? Then it started to become more of a situation just about how do we handle this with our families? What do we do now that schools are shut down? And now that we're at the stay-at-home, well, I'll show you behind me. I work in downtown Seattle. This road, there's constantly traffic on it every single day. In fact, if I walk to the corner here, you'll see I'm just around the corner from the Space Needle. Yeah, they shut that thing down just a couple weeks ago. This has been one of those things where we're just seeing less foot traffic, less people. Even our morning show, as we've started to develop people off-site so that we don't have to report to work directly, we even had to have our traffic reporters start reporting on the coronavirus because there isn't traffic in the morning. And that's rare because it's one of the busiest jobs in our newsroom. Typically, it can take some people upwards of an hour and a half to get to Seattle because it's such a dense populated area. A lot of people travel from a distance and the roads are just log jammed. So we're seeing the reaction to the stay at home. A lot of people not there, a lot of people asking questions about what are we gonna do. They've suspended rent payments in our area across the entire state, so that should help some people, but there's the real economic fallout that we're dealing with here on top of the health crisis itself. So we'll continue to track it for you here from the ground. I'm Matthew Smith reporting in Seattle. Send it back to you guys.